Welcome to Business India, your go-to destination for insightful discussions and analysis on the dynamic world of business in India. I'm thrilled to embark on this journey with you as we delve into the vibrant tapestry of entrepreneurship, innovation, and economic developments shaping the Indian business landscape. In today's modern workplaces, companies are increasingly implementing wellness surveillance programs with the goal of promoting employee health and reducing healthcare costs. However, these programs can actually end up having the opposite effect, making workers feel unwell due to the invasive nature of the monitoring and data collection involved. What exactly is wellness surveillance? It refers to employers using various technologies like wearable fitness trackers, smartphone apps, and other digital tools to collect detailed data about their employees' personal health metrics and lifestyle habits. This can include information on physical activity levels, sleep patterns, nutrition, stress levels, and even things like genetic data. The idea behind these wellness surveillance programs is that by closely monitoring worker health and behavior, employers can identify potential health risks early on. They can then develop wellness initiatives and interventions targeted at encouraging healthier habits among employees. Things like stepping challenges, nutrition coaching, mindfulness training, and the like. On the surface, this approach seems well-intentioned. After all, having a healthy, fit workforce can reduce sick days, lower insurance costs for the company, and boost productivity levels. Employers can tout their wellness program as an attractive employment perk for recruiting top talent as well. However, the reality is that this intensive health monitoring and data collection raises major privacy concerns for workers. It represents a significant invasion into the personal lives and private health matters of employees. Imagine having your employer track how many steps you take each day, monitor your sleeping patterns at night, analyze what kinds of foods you're eating. This level of health surveillance can understandably make people feel incredibly uncomfortable. It creates a workplace culture of surveillance and lack of personal autonomy. There are risks that the sensitive health data being collected could potentially be breached, hacked, or misused in some way. Even if the employer has robust data protections, just the idea of having such private information collected can lead to feelings of mistrust and discomfort among staff. Beyond privacy issues, wellness surveillance also runs the risk of stigmatizing or discriminating against employees with certain health conditions or perceived unhealthy lifestyle habits. If management has access to detailed personal health metrics of workers, there could be conscious or unconscious biases that negatively impact employment decisions like promotions or terminations. The fear of being judged, stigmatized, or penalized for health data could then cause some employees to be less transparent about actual health struggles they may be facing. It may discourage them from seeking appropriate medical care or support that they need. Some may even feel pressured to develop unhealthy behaviors like excessive exercising or disordered eating in an attempt to modify the health data being monitored and give the appearance of being perfectly healthy and fit. This could end up seriously compromising their overall wellness. There's also the broader philosophical issue that wellness surveillance places too much of the onus and responsibility for health solely on the individual employee. It promotes an illusion that workers have full control over all aspects of their personal health. But in reality, overall well-being is influenced by a complex mix of genetic factors, environmental circumstances like access to healthcare or safe living conditions, and socioeconomic status, not just individual choices about diet and exercise. Workers in low-income areas with food deserts or those juggling multiple jobs may have significantly less control. By making personal health metrics so granularly visible to the employer, it can create undue guilt, shame or added stress when people aren't able to adhere to idealized standards of healthy behavior that the workplace is promoting. From an ethical standpoint, collecting and leveraging this level of private health data from employees without full transparency and control raises concerns around violating personal privacy, worker autonomy, and dignity. Even if well-intentioned, it represents a moral overstep by employers into the personal lives of their staff. There are also legal considerations around wellness surveillance that employers need to carefully navigate. Laws like the Americans with Disabilities Act, ADA, and the Genetic Information Non-Discrimination Act, GINA, limit what kinds of private health data can be requested by employers. However, the capabilities of wellness surveillance technologies are evolving rapidly, with the potential to outpace existing regulations aimed at protecting worker privacy rights. It's an area of employment law that will likely require continuous revisiting as these issues emerge. So while wellness programs in theory could provide health benefits, the overly invasive surveillance aspect can actually end up undermining worker well-being in several key ways. Feeling a lack of personal privacy and individual autonomy. Increased stress, anxiety, and discomfort. Potential discrimination based on health data. Discouraging transparency about genuine health needs. Promoting unhealthy behaviors to game the monitoring. Creating guilt, shame, and the illusion of full personal health control. Raising ethical concerns around worker dignity and consent. The solution is to find a better balance, one that still encourages workplace wellness but without violating the privacy and personal boundaries of employees. Rather than intense individual surveillance, companies could focus wellness efforts more on education, providing helpful resources, and creating an overall workplace environment and policies that are conducive to healthy behavior. For example, offering in-office exercise facilities, healthy food options, appropriate ergonomic workstations, adequate break times and the like, but making the choice to utilize those options fully voluntary for each employee based on their personal preferences. If wearable fitness trackers or health coaching apps are used, they should be opt-in only with strict protocols around protecting private data. And employers need to build a culture of trust that using such tools won't impact job status. At the end of the day, heavy-handed surveillance and monitoring may seem well-intentioned from a corporate wellness perspective. But it often ends up having the opposite effect, making workers feel mistrustful, stressed, and ultimately unhealthy due to the invasion into their personal lives. Encouraging healthy habits is a noble goal. But it's one that's better achieved through empowerment, education, and personal choice, not invasive surveillance measures that strip away privacy and worker autonomy. True wellness needs to prioritize the whole employee, including their basic dignity, boundaries, and rights in the workplace. If you're passionate about exploring the vibrant world of Indian businesses and staying ahead in the competitive market, make sure to subscribe to Business India. Don't forget to hit the like button and share our content with your network. Together, let's foster a community of knowledge sharing and success in the realm of business. Subscribe, like, and share to stay informed and inspired.